Hello, and thank you for joining us for this short webinar today. We're here to talk about adult vaccinations, why they matter, who should get them, and how they help protect not just individuals but entire communities. Vaccines aren't just for children, they are a vital part of staying healthy throughout adulthood. We will cover information on flu, COVID-19, pneumococcal, shingles, RSV, how can you help, useful links to other information, FAQs. What is flu? A viral infection that affects the respiratory system, including the nose, throat, and lungs. People in older age groups, children 2 to 3 years old, pregnant women, and those with certain health conditions are most at risk of getting seriously ill with flu. What is COVID-19? A viral infection that affects the respiratory system. Similar symptoms to flu, including fever, cough, fatigue, and sore throat. Most people feel better within a few days or weeks of their first COVID-19 symptoms, but for some people, it can be a more serious illness and symptoms can last longer. What is pneumococcal disease? It can cause mild ear infections, sinusitis, and bronchitis. In worst cases, it can also cause septicemia, pneumonia, and meningitis. What is shingles? A common condition that causes a painful rash. It can sometimes lead to serious problems such as long-lasting pain, hearing loss, or blindness. You're more likely to get shingles, and it's more likely to cause serious problems as you get older or if you have a severely weakened immune system. What is RSV? Respiratory syncytial virus, an infectious disease of the airways and lungs, causes symptoms similar to a cold. It can also make you become wheezy or short of breath and lead to pneumonia and other life-threatening conditions. Vaccines are one of the most effective tools we have to prevent serious illness. As we age, our immune system changes and we become more vulnerable to infections like flu, shingles, and pneumonia. Vaccinations help reduce hospital admissions, protect vulnerable groups, and ease pressure on the NHS, especially during the winter months. Let's look at the key vaccines recommended for adults in the UK. Flu vaccine, offered yearly for those 65 and over, in clinical risk groups and frontline workers. The cohort can change every year. COVID-19 booster, offered in the spring and autumn to those 75 and over, immunosuppressed, and care home residents. The cohort for COVID can also change every year. Shingles vaccine. You are eligible for the shingles vaccine if you are aged 70 to 79 up to your 80th birthday. Those who turn 65 from the 1st of September 2023, aged 18 and over with a weakened immune system. Pneumococcal vaccine, PPV, for adults 65 and over and those with certain health conditions. RSV vaccine, newly introduced in September 2024 for adults 75 and over. Co-administration. If you are eligible for more than one adult vaccine, you can get them all together. Seasonal vaccinations remain a critically important public health intervention and a key priority to reduce illness, deaths, and hospitalization associated with influenza, flu, and COVID-19. Flu and COVID-19 vaccinations are delivered predominantly during the autumn-winter months through general practice and community pharmacies. COVID-19 spring booster vaccinations are normally also available to some cohorts of people in spring to provide extra protection. The eligibility criteria is shared nearer the time of the spring campaign. Seasonal flu vaccination remains a critically important public health intervention and a key priority for 2025 to 2026 to reduce illness, deaths, and hospitalization associated with flu. The flu vaccine eligibility changes every year because the virus constantly evolves and immunity fades over time, so the vaccine is updated to match the most likely circulating strains. The eligibility for the flu vaccine from 1st of October 2025. Those aged 65 years and over. Those aged 18 years to under 65 years in clinical risk groups, as defined by the Green Book, Influenza Chapter 19. Those in long-stay residential care homes. Carers in receipt of carers allowance or those who are the main carer of an elderly or disabled person. Close contacts of immunocompromised individuals. Frontline workers in a social care setting without an employer-led occupational health scheme, including those working for a registered residential care or nursing home, registered domiciliary care providers, voluntary managed hospice providers, and those that are employed by those who receive direct payments, personal budgets, or personal health budgets, such as personal assistance. Like flu, COVID-19 vaccines are updated annually to match circulating strains. They are offered in autumn and spring to protect high-risk groups. Co-administration is encouraged, meaning you can get other adult vaccines, such as flu, at the same time for convenience and better protection heading into winter. The UK COVID-19 vaccination programme enters its fifth autumn season. Vaccination helps to protect against severe illness, hospitalisations and deaths from COVID-19. The advice for this autumn is to offer the vaccine to those at high risk of serious disease and who are therefore most likely to benefit from vaccination. The COVID-19 programme will start on the 1st of October 2025. For autumn 2025, COVID-19 vaccination will be offered to adults aged 75 years and over, residents in care homes for older adults, individuals who are immunosuppressed aged 6 months and over. If you are eligible, you can get a COVID-19 vaccination from a walk-in site without an appointment. Find a walk-in COVID-19 vaccination site on www.nhs.uk. Select the Find a Walk-in Site button to look for walk-in sites near you. You can book at a local pharmacy using the NHS app, NHS booking system, or call the COVID-19 service on 119. Translators are available. You can also book COVID-19 and flu vaccines via your GP by contacting them directly to book your appointment. RSV is a common respiratory virus that can be serious for older adults. In 2024, the NHS introduced the RSV vaccine for those aged 75 and over. It helps prevent hospitalisation and complications like pneumonia. This is a big step forward in protecting older populations. RSV is an infectious disease of the airways and lungs. RSV infection often causes symptoms similar to a cold, including a cough, sore throat, sneezing, a runny or blocked nose. It can also make you become wheezy or short of breath and lead to pneumonia and other life-threatening conditions. There is no specific treatment, and most infections will get better by themselves. Every year, thousands of older adults need hospital care for RSV, and some of them will die. RSV can be more severe in people with medical conditions such as heart or lung disease or a weakened immune system. RSV infection is common in young children, but it is most serious for small babies and for older people. There is further information on RSV on Your Guide to the RSV Vaccine for Older Adults, gov.uk, www.gov.uk. The UK was the first country in the world to have a national programme that uses the same vaccine to protect both newborns and older adults against RSV. In England, the rollout started on the 1st of September 2024, including a vaccine for pregnant women over 28 weeks to help protect their newborn babies, a routine programme for those over 75. These are the groups at the greatest risk from RSV, based on advice from the Joint Committee on Vaccination and Immunisation, JCVI. Note, RSV is a new vaccine. Raising awareness of RSV and the importance of vaccination is a priority. You can read more about the vaccine on National RSV Vaccination Programme announced, gov.uk, www.gov.uk. Pneumococcal disease can cause pneumonia, meningitis, and sepsis. It's especially dangerous for older adults and those with chronic conditions. The PPV vaccine protects against 23 strains and is offered to adults 65 and over, and those with conditions like COPD, diabetes, or a weakened immune system. Pneumococcal disease is a name for any infection caused by the bacteria called Streptococcus pneumoniae or pneumococcus. Pneumococcal infections can range from ear and sinus infections to pneumonia and serious bloodstream infections. Further information can be found pneumococcal vaccine, NHS, www.nhs.uk. The pneumococcal vaccine helps protect against some types of bacterial infections that can cause serious illnesses like meningitis, an infection in the brain and spinal cord, sepsis, a life-threatening reaction to an infection, pneumonia, an infection in the lungs. Pneumococcal vaccines encourage your body to produce antibodies against pneumococcal bacteria. Antibodies are proteins produced by your body to neutralize or destroy disease-carrying organisms and toxins. They protect you from becoming ill if you are infected with the bacteria. Anyone can get a pneumococcal infection, but some people are at high risk of serious illness, so it is recommended they are given the pneumococcal vaccination on the NHS. These include babies, adults aged 65 or over, those aged 2 to 64 with a long-term health condition, such as serious heart, lung, or kidney condition. Most people over the age of 65 will only need one dose, which will help to protect them for life. Shingles affects 1 in 4 people, mostly over 70. It's caused by the reactivation of the chickenpox virus and can lead to severe nerve pain called post-herpetic neuralgia. Shingles is a common condition that causes a painful rash. It can sometimes lead to serious problems such as long-lasting pain, hearing loss, or blindness. You are most likely to get shingles, and it's more likely to cause serious problems as you get older or if you have a severely weakened immune system. If you think you might have shingles, contact your GP or get advice by calling 111 or get help from 111 online as soon as possible. You might need to get medicine to help speed up your recovery and avoid longer-lasting problems. This works best if you start taking it within 3 days of the shingles rash appearing. A pharmacist can also help with shingles. They can provide the same treatments you would get from a GP. If you need it, find a pharmacy. The first sign of shingles can be a tingling or painful feeling in an area of skin, a headache or feeling generally unwell. A rash will usually appear a few days later. In rare cases, shingles can cause pain without a rash. Usually, you get shingles rash on your chest and tummy, but it can appear anywhere on your body, including on your face, eyes, and genitals. The rash appears as blotches on your skin, on one side of your body only. A rash on both the left and right of your body is unlikely to be shingles. Here are some images of what shingles looks like. Blotches that become itchy blisters and scab after a few days. It can be hard to see on dark skin and can appear in and around your eyes. The shingles vaccine reduces the risk of getting shingles. If you do go on to have the disease, your symptoms may be milder and the illness shorter. You are eligible for the shingles vaccine if you are aged 70 to 79, those who turned 65 from the 1st of September 2023, aged 18 and over with a weakened immune system. Once you become eligible for shingles vaccination, your GP surgery will invite you to make an appointment. It is fine to have the shingles vaccine if you have already had shingles. The shingles vaccine will boost your immunity against further shingles attacks. Your GP will tell you how long to wait after you recover from shingles before having shingles vaccine. Unlike the flu vaccine, you will only need to have the vaccination once, and you can have it at any time of the year. You can be given the shingles vaccine alongside other adult vaccines, such as flu and COVID. Raise awareness of adult vaccines, shingles, pneumococcal, flu, COVID, and RSV, including eligibility criteria and signs and symptoms. Increase awareness of the risks for certain age groups. Increase understanding of how you can support people or whatever support is available, such as reasonable adjustments. Signposts to key links and resources. Frequently asked questions, FAQs. addressing myths and misinformation. There's a lot of misinformation about vaccines. Let's be clear, vaccines do not cause autism. They do not overload the immune system. Ingredients are safe and rigorously tested. Vaccines save lives. They're based on decades of research and are monitored continuously for safety. Making every contact count. Speaking to people about the benefits of having vaccines and how they can protect health. Making sure your wider team are aware of the vaccine, eligibility, and how to access. Help people to book appointments online, NHS app, self-booking links, or calling 119, and supporting with transport where possible. Putting up posters, sharing leaflets, or distributing information to raise awareness. Here are some links to further information about all adult vaccinations we have discussed today. There are a range of resources available in translated formats and also the Winter Toolkit with further information. A few examples of resources you can get from Health Publications website. There is a QR code to this website on this slide. To find out what resources and information the Public Health Resource Centre can provide on this and other public health topics, explore the website at www.leeds.gov.uk/PHRC or watch this short film https://. You can also find vaccine resources to support you from the Public Health Resource Centre. Here are the key adult vaccination messages. Get vaccinated to reduce your risk and protect yourself against infections that can cause serious illnesses in adults. Once you become eligible for adult vaccination, your GP will invite you to make an appointment. You can also contact your GP surgery to check if you are eligible. Some vaccines are delivered seasonally, such as flu and COVID. You can get other adult vaccines throughout the year. Please note if eligible for more than one adult vaccine, you can have them co-administered at the same time, along with seasonal vaccines. All adult vaccines are given at GP and community pharmacy. More information about adult vaccines can be found here. Vaccinations, NHS. You can book appointments online or by phone. If you are eligible, don't wait to get protected, and please help spread the word to friends, family, and colleagues. Some frequently asked questions. Can injection give me the illness? No. Inactivated vaccines are made of the dead antigen, and so cannot recreate the disease, only the antigens to kill the disease. Poorly? People get poorly from the vaccine straight away. Will I get poorly? There are side effects for every medication. The most common for vaccination is tiredness, pain, and swelling at the point of injection. However, it takes 2 to 3 weeks for the vaccine to become effective, so any illness is usually coincidental. Having more than one vaccine at a time will overload my immune system and make me poorly. Research has been carried out in this area, and nearly all vaccines can be given together, with the exception usually for new vaccines and certain live vaccines, like COVID, when it first came out, and RSV. Your body is attacked by antigens daily, and your immune system is primed to deal with this. We are only introducing 1 or 2 to your immune system. Thank you for taking the time to listen to this webinar and supporting adult vaccination programs. Hope you found the information useful.